Welcome to HealthU. Today we're sharing a groundbreaking discovery that could transform the lives of diabetes patients. Just one small cup of apple cider vinegar daily can simultaneously improve both blood glucose and blood lipids. And this isn't just folk medicine, but scientifically proven medical research. The latest randomized controlled clinical trial published in an international journal shows that type 2 diabetes patients who consumed 30 milliliters of apple cider vinegar daily experienced significant improvements in blood glucose control after 8 weeks, with even the most important marker, hemoglobin A HbA1c, showing notable reduction. Even more remarkable is that LDL cholesterol also decreased dramatically. What does this mean? It means apple cider vinegar, ACV, could be a dual blessing for diabetes patients. Let's examine just how impressive this research really is. Iranian researchers recruited adult type 2 diabetes patients and randomly divided them into two groups for the experiment. The intervention group consumed 30 milliliters of apple cider vinegar daily, while the control group received only general healthy dietary advice. The test results after 8 weeks amazed even the researchers themselves. Regarding blood glucose control, the intervention group showed significant reduction in fasting blood glucose, with statistical significance reaching 0.01, a highly meaningful result in medical research. More importantly, the improvement in hemoglobin A1c was extremely significant, with the difference between groups showing a p-value less than 0.001, indicating that apple cider vinegar genuinely helps with long-term blood glucose control. The blood lipid improvements were comprehensive. Low-density lipoprotein cholesterol, what we commonly call bad cholesterol, decreased significantly in the apple cider vinegar group with a p-value less than 0.01. Total cholesterol levels also showed marked improvement, and both the LDL to HDL ratio and total cholesterol to HDL ratio were optimized, all important indicators of cardiovascular health. So why does apple cider vinegar have these effects? The scientific mechanism is quite fascinating. The primary component of apple cider vinegar, acetic acid, can regulate our metabolism from multiple angles. First, acetic acid delays gastric emptying speed. Simply put, it makes food stay in the stomach longer, preventing rapid blood glucose spikes. At the same time, acetic acid can inhibit alpha amylase activity, an important enzyme for starch digestion. When inhibited, it reduces carbohydrate digestion and absorption. Even more impressive is that apple cider vinegar can improve insulin sensitivity. Poor insulin sensitivity is a core problem in type 2 diabetes, and apple cider vinegar can enhance cellular response to insulin, making blood glucose more easily utilized by cells. Additionally, it promotes muscle tissue glucose uptake, enhancing glucose utilization efficiency in peripheral tissues. Regarding blood lipid regulation, apple cider vinegar can inhibit cholesterol synthesis enzyme activity, directly reducing cholesterol production at the source. This explains why the research showed significant improvements in both total cholesterol and LDL cholesterol. So how should people use apple cider vinegar to obtain these health benefits? Based on research results, the recommended dosage is 15 to 30 milliliters daily, taken in 1 to 2 doses. The optimal timing is 15 to 20 minutes before meals, diluted in 200 to 300 milliliters of warm water. Why dilute it? Because apple cider vinegar is highly acidic, and direct consumption could damage tooth enamel and esophageal mucosa. Dilution not only makes it more palatable, but also protects our oral and digestive tract health. To see significant effects, at least 8 weeks of continuous use is necessary. This isn't a quick-fix medicine, but rather a functional food that requires consistent use to be effective. Like exercise and dietary control, it requires persistence. Of course, while apple cider vinegar is relatively safe, it's not suitable for everyone. If you have excess stomach acid or gastric ulcers, it's best to consult a physician before use. Patients taking blood glucose-lowering medications need to be especially careful, as apple cider vinegar combined with medications might cause blood glucose to drop too low, creating hypoglycemia risk. Kidney disease patients also need special attention, as apple cider vinegar has relatively high potassium content that might affect kidney function. Any chronic disease patients should discuss with their attending physician before use. There are also tips for purchasing apple cider vinegar. Choose naturally fermented apple cider vinegar containing mother of vinegar, as this type retains more bioactive substances. Avoid products with added artificial flavors or sugars, as these additives might counteract apple cider vinegar's health benefits. While current research shows positive results, we must acknowledge some limitations. The study sample size was relatively small, and long-term safety data is limited. Different apple cider vinegar brands may vary in composition, and individual physiological differences can affect results. Future research needs larger-scale long-term follow-up studies to establish more comprehensive usage guidelines. However, based on current evidence, apple cider vinegar is indeed a worthy auxiliary treatment option to consider. It's crucial to emphasize that apple cider vinegar cannot replace proper medical treatment. Its most appropriate role is as part of a healthy lifestyle, combined with balanced diet, regular exercise, and physician-prescribed medications, collectively enhance health. For type 2 diabetes patients, the dual improvement in blood glucose and blood lipids is tremendously significant. This isn't just numerical changes, it relates to reduced complication risks. Cardiovascular disease is one of the most serious diabetes complications, so if apple cider vinegar can truly improve both blood glucose and blood lipids simultaneously, it's definitely good news for patients' long-term health. In summary, one small cup of diluted apple cider vinegar daily might be your simple first step toward better health. Of course, before starting, remember to discuss with your physician to ensure this method suits your physical condition. There are no shortcuts to health, but scientific research tells us that sometimes the simplest natural foods hold unexpected health secrets.